have you join us for this online discussion organized by the European Public Health Alliance. My name is Rok Hržić. I'm a lecturer and researcher at Maastricht University and will have the pleasure of moderating today's discussion. There's an interesting controversy surrounding the question who invented the phrase data is the new oil. The current consensus places the credit with Clive Humby, the UK mathematician and designer of Tesco's Club Card, who in 2006 said, data is the new oil. It's valuable, but if unrefined, it cannot be used. It has to be changed into gas, plastic, chemicals, etc., to create a valuable entity that drives profitable activity. So, data must be broken down and analyzed for it to have value. I think we all here today agree that improved access to and use of health data holds an immense potential to transform healthcare and health systems. However, as Humby observed, this transformation will happen only once health data can be reliably accessed, analyzed, and insights transformed into better health research, better decisions about care, and better health policies. The European Health Data Space, about which we will soon hear more, aims to provide a framework across EU member states that will allow for the sharing and exchange of health data, including electronic health records, patient registries, and genomic data. However, as we focus on solving the technical challenges of data interoperability and legal challenges of cross-border data transfer, we need to ask, are we paying enough attention to the ethics of data sharing? The questions of data ownership, control over data processing, and the use of health data in line with our common health system's values of universality, access to good quality care, equity, and solidarity are critical issues that need to be addressed. To help us do so, today's online discussion brings together policymakers and members of the civil society to discuss the implications of the European health data space for EU citizens. With us today are Arthur Dufresne from France ESO Santé, Linda Abdellal from the European Cancer Leagues, Denis Onyango from the European AIDS Treatment Group, Hugo van Haastert from DG Santé Unit B3, and Petrica Dulgeru from the Roma Entrepreneurship Development Initiative. At this point, I would invite the panelists to briefly introduce themselves and tell us how their work relates to the European health data space.
Okay, so maybe I will go first. Thanks a lot for the introduction. So I am Arthur Dauphin from France ESO Santé, which is the unions of French patients associations. And so we represent more than 85 national associations and more than 900 local ones. And we have a public interest mission to represent the voice of users in the health democracy in France. And so our work related to the European health data space is more focused on projects that we develop with the French Public Health Data Hub and how we can nurture a culture regarding health data among users and improve their use of this data for what you say for the individual health pathway, refine research, and better healthcare system.
My name is Linda Abdellal. I'm the Policy and Project Officer of the Association of European Cancer Leagues. The Association of European Cancer Leagues, ECL, is a non-profit pan-European umbrella organization representing national and regional cancer societies across the WHO European Union region, so beyond the European Union. We have 30 members representing 25 countries. So in some situations, we have also, for this reason, more than one cancer league per country. For instance, Belgium, we have both the Belgium and the Flemish one. And when it comes to the European health data space and how this is connecting to cancer, actually, we have seen yesterday that the European Commission published the implementation roadmap following the European Beating Cancer Plan, and the European health data space is mentioned in several points. So the European health data space is really connected to many activities, but I can say that in our case, to the European Beating Cancer Plan.
And I'm Denis Onyango from the European AIDS Treatment Group. So EATG works to advance the rights of people who are living with or affected by HIV across the European region. And we are very, very, interested in this area. EHDS as an organization is interested in developing e-health solutions that can increase the quality of life for people living with HIV, but also address some of the serious issues like stigma and challenges that especially underserved populations experience. And so it's our hope, obviously, that the European health data space will increase provision while maintaining the privacy and confidentiality of people living with HIV. So really, really looking forward to this discussion. Thank you.
So maybe I can go next. My name is Hugo van Haastert. I'm a policy officer in the European Commission in DG Santé, the unit B3, which is the unit that's responsible for the policies on digital health, but also on rare diseases. So happy to be here and to tell you more about the legislative proposal for the European health data space.
Maybe it's my turn. So I'm Patrick Adolguero. I represent the Roma organization. The organization is called Roma Economic Development Initiative. So we work in 4 countries, 2 in the European Union, 2 outside of the European Union, Romania, Bulgaria, Serbia, and Macedonia. And we're in touch with about 4,000 entrepreneurs and people working in these communities, but also with more than 60 other communities in which Roma live. The reason why I believe this is a very important meeting is because we're extremely concerned with the impact that data collection and the way those data can be used when it comes to vulnerable communities. So we started really looking into how can the new tools, which are developed with the best means and the best intentions, can actually have unintended consequences. So I'm really looking forward to the conversation.
Thank you, everyone, for these introductions. It's really a pleasure to have you here, and I really look forward to digging deeper into some of the issues you've highlighted at this point. I would like to now pass over the stage to Hugo, who will introduce the state of play regarding the European health data space. Hugo, the floor is yours.
Thanks so much, Rok. Indeed, let me take you through a couple of slides on the European health data space as we are now developing the proposal. Next slide, please. So the European health data space will actually come at health data from 2 perspectives, and these are the primary and the secondary use of health data. And the primary use is the use of health data in a clinical setting, where the data is used to provide healthcare or to record data in the space of public health. And the secondary use of health data is where health data is reused for other purposes. This can be research, it can be innovation by industry, it can be policy making, it can also be regulatory purposes and oversight of government bodies. And then if you look at this overview here, the proposal will address obviously legal and governance issues, but it will also look at the quality of health data, which is paramount. It will look at the way infrastructure is organized and introduce infrastructures at the European level. And last but certainly not least, the proposal will also look at capacity building. Capacity building means that we are looking at member states that are lagging behind in their investments and their realization of digital health infrastructures to support these. One good example would be the Recovery and Resilience Facility, the 750 billion euros that is available to member states to invest in national infrastructures. 20% of that is earmarked for digital. And we see a lot of member states are therefore using these funds to invest in digital health, to strengthen the infrastructure and the training of staff, et cetera, So this is for us a very important part of the proposal, that we make sure that capacities are there across the EU because it's always the weakest link that you depend on for safety, etc. So this is an important aspect as well. Next slide, please. So we've identified in our consultation of stakeholders over the last months and years, we've identified a number of problems and areas where the legislation should then work and address these problems. So on the primary use of health data, we see that there are problems when it comes to the limited control of patients over their own data, and also limited interoperability between healthcare providers, which means that data cannot easily be shared across different silos, both domestically and across borders. And there are areas of work to give patients more control over their data, to introduce standards for interoperability, to strengthen the role of e-health agencies, and to reinforce existing European governance and existing European infrastructures. And now also in the area of the primary use of health data, we see that there are problems with the single market. Really, there is now currently not a single market for digital health services and products, but rather there are hundreds of markets, because a lot of member states have introduced barriers and often have devolved this to regions or the local level, which introduce even more barriers. So you see an uneven national legislative framework, uneven quality frameworks, uneven procedures for prescription, reimbursement, liability. So the legal proposal will look at how we can eliminate those barriers to promote the free movement by labeling, introducing standards for interoperability, but also seeing how we can make it mutually recognized when member states make decisions in areas such as reimbursement and liability. Now, when we go over to the secondary use of health data, which is where we reuse the data for research and innovation, etc., there we also see that there is a low reuse of health data. It's cumbersome for parties to get access to the health data. Infrastructures are very fragmented. So here too, we'll be looking at how we can introduce governance and rules across the EU to make this easier, to facilitate the access to health data, make it fair, which is findable, accessible, interoperable, and reusable, and to introduce a European level digital infrastructure. And then this is also, if you look at the problems pertaining to AI for healthcare, this is quite similar. Here too, you see that there are problems in accessing the data, which is of course paramount. If you want to train and develop your algorithm, you'll first need access to proper quality data. And here too, we also see that regulators have difficulty to evaluate the algorithms, and there are certain uncertainties in the legal space pertaining, for instance, to liability. So here too, we'll be looking at how we can further support, the access to data and to take away these different barriers, and to support the regulators as well in their efforts to regulate the space. Next slide, please. So when it comes to the European health data space, this piece of legislation will be, of course, developed in concert with already existing legislation and legislation that has been put forward by the Commission. So we have now, 10 years ago, the adoption of the Cross-Border Healthcare Directive. We have the GDPR in place, and the Commission has always also put forward legislation in the area of data governance and AI, the AI Act proposal. So we'll need to make sure that the legislation fits in perfectly with these existing pieces of legislation, and it will also build upon certain aspects of the DGA, the Data Governance Act. Next slide, please. Next slide again. So this is on the primary use of health data. We'll be zooming in. And the legislation aims to grant citizens and healthcare professionals access to health data across borders in an interoperable digital format. And this is a simplified overview. If you are a patient and you have your health data stored in Belgian hospitals or with your Belgian GP, and you are traveling to Latvia and unfortunately you fall ill, then the Latvian nurse and doctor should be able to access your records in Belgium in an interoperable format, of course electronically, and this should all be organized in such a way that you as a patient can trust the system to only give people access to your data where they need it. Next slide, please. And so this is, these are a lot of the challenges, excuse me, that we're facing. One of them is that right now, a large amount of health data is not even held in a digital format. So data are often available in paper, or only a limited set of data categories are available in a digital format. So this is one of the issues we'll be addressing. Another aspect is the interoperability, and this pertains to the fact that the format is different everywhere, which makes it very difficult for users to understand the data properly. And what we also see is that there are different tools and infrastructures in place across the different member states. So you have certain countries have introduced portals, and others have introduced personal data spaces, but these are not interoperable across the systems. Excuse me, 1 second, please. Sorry about that, just needed to drink some water for my throat. So what we have set up at the European level is the My Healthy EU infrastructure. And this is an infrastructure that will facilitate the exchange of health data across borders. If we could go to the next slide. So here we see the infrastructure already in place in certain member states. As you can see, countries like Finland, Estonia, Czechia, and Portugal are already live. And more countries will be onboarding in the next few years. And what is being exchanged right now is patient summaries and e-prescription, which means that if you are a doctor in Finland and you have a patient from Estonia or from Portugal and they fall ill in Helsinki, then through this system you can access the patient summary and the e-prescription information, and this should help you to provide better healthcare. So the number of member states are expanding, and also we're looking at how we can expand the use cases. So we're looking at lab results, medical images, discharge letters, and this should all promote the further exchange of health data across the EU. And what we'll also be piloting is the concept of giving patients access to their data. This pilot should start running next year, and this means that if you are already living in Finland and your country is already connected to the infrastructure, as a Finnish citizen, you will be able to access the data to see which information is stored and with whom it is shared. Next slide, please. This is another interesting example from the country of Belgium, where they have developed a validation pyramid for telehealth and mHealth solutions. So here you see that the pyramid at the bottom looks at whether a solution is CE certified as a medical device. Then the next level of the pyramid further up is to see whether it can be safely connected to the e-health ecosystem that is in place in Belgium. And then the top of the pyramid is to see whether there is socioeconomic evidence, and then it can get reimbursed by the different healthcare insurers in Belgium. And we are looking at how different member states are developing similar mechanisms to see how we can introduce such mechanisms at the European level. Because right now, if you are industry and you've developed a beautiful solution, you can sell it to patients in Belgium. But then as soon as you want to provide this same service to patients across the border in France or in Germany, all of a sudden you see a lot of barriers come your way. And it's very costly for you to then adjust your product to be able to also introduce it in other healthcare settings across the borders. Next slide, please. This is one of the reasons why we've developed, together with CEN and ISO, a standard for health apps. It's been approved earlier this year, and this standard would look at different aspects, very comparable to the energy label that you have if you go shopping for a new washing machine. The energy label will tell you the energy efficiency of the product, and this label would tell you different aspects about health apps. It could tell you about the outcomes for health, whether it will promote your health, the ease to use, the security of your data, and of course also whether it would be interoperable with different health solutions, health software solutions, such as the electronic health record system held by your doctor, your hospital, your GP. Next slide, please. So when it comes to the primary use, the legislative proposal aims to achieve a number of things. It looks at expanding the rights of citizens to access and portability of health data. It wants to strengthen the position of the currently existing e-health network. It wants to expand on the existing infrastructure that I just explained. and it would promote interoperability of health software solutions across the board, including electronic health records, apps, medical devices, etc. Next slide, please. So now we move on to the secondary use of health data, the reuse of health data for research, innovation, policymaking, and regulatory decisions. Next slide. So here too, we aim to organize at the European level a mechanism that should grant researchers, policymakers, and industry access to health data across borders in an interoperable and digital format. And this would obviously help researchers, industry, policymakers with their work to make new products that could improve healthcare, to improve policy, and of course for researchers to introduce interesting innovations in the healthcare setting. And what you would need to make this possible is at the European level, you need rules, protocols, and a governance so that everyone can trust that this takes place in a fair, equitable way. Because you would be granting access to health data from patients, from healthcare professionals, but also from researchers, from industry. So you would be opening up the exchange, and this has to be done in such a way that everybody still trusts the system. Next slide, please. And here we've looked at the way that this is already organized in certain member states. Some examples are Finland, Denmark, France. These member states have introduced through legislation national institutions that grant access to health data for secondary use. And this is an interesting example for the European Commission to look at, because these institutions promote the reuse of health data in an equitable way, and of course in such a way that it still promotes trust in the public at large. What we would like to achieve is to introduce nodes at the national and the European level. So at the national level, it could be these institutions like FinData and the French Health Data Hub, but it could also be parties like the European Medicines Agency and ECDC in Stockholm, and of course existing research infrastructures, because the European Commission has supported and funded many research infrastructures to be developed at the European level that have collected and have analyzed a lot of health data and introduced a lot of potential for research and innovation. And these infrastructures would then also be connected to the European health data space for secondary use ecosystem. And as you can see, these different nodes could then exchange with each other, all under the same rules that would be introduced in the European health data space legal proposal. Next slide, please. So here too, we're looking at the expanding on the existing infrastructures in member states by introducing a European infrastructure, promoting interoperability, promoting the transparency of data quality, and strengthening the legal base for the reuse of health data. Next slide, please. So just to give you a bit of an overview of where we stand and what the next steps are. So earlier we started off with the inception impact assessment, which is where the Commission announces their intent to develop legislation. We've also had the public consultation, which ran from May to July in this summer. Then we have different studies that have, some of which have been published, that look at different aspects of the European health data. One study that's been published is on the rules that are in place in member states on health data. And another study that's been recently published by our colleagues in Connect looks at the maturity of interoperability in different member states when it comes to health data exchange. And we are still in the process of finalizing studies on regulatory gaps, which looks at policy in member states, a technical infrastructure study that we'll be finalizing, and a impact assessment of the legal proposal itself, which of course is paramount, because any proposal will introduce costs and benefits. So these have been mapped in the impact assessment. And we hope that next year, hopefully March, April, we'll be able to actually publish both all these different studies and, of course, the legal text and the legal proposal itself. Next slide, please. That's my last slide. So thank you so much for paying attention, and I look forward to the discussion. Thank you.
Thank you very much, Hugo, for this interesting presentation, providing us some very much needed insight into what's currently happening in the EHDS space. I would now invite all the panelists to take the proverbial stage by turning their cameras on. We'll start with a few questions I prepared. However, audience, please note that we are also very happy to take your questions if there's time. So I would invite you to share those via the Q&A tool at the bottom of your screens as well. Let's start with a broad question to all our panelists from civil society. What do you see as the key opportunities of the European health data space for civil society? And what do you see as the key threats of the EHDS? Just jump in whenever you're ready.
Yeah, so I'll go first, probably. Yeah, so I think that especially as a patient-led organization, EHDS sees a lot of opportunities here to be able to advance, have better insights into a lot of healthcare provision and to have a more integrated approach to care. So as we know that, currently, there are significant inequalities, especially in terms of digital access. So we know, for example, that in certain communities or in certain populations or in certain therapy areas, there is significant barriers to digital literacy. But also, I think just the understanding of what digital health or data means actually to some people. So I think that this really is harmonizing regulations, trying to share information across borders. I think that will increase significantly the benefits of research and will ensure that quality of life improves and that healthcare provision improves. But I think also the challenge really for us is really around the control of data and who has access to that data. So we know, for example, that in the UK, we've had cases of healthcare data being used to, for example, enforce immigration, rules, and so that has scared a lot of people, and that has also raised concerns around people's privacy. So I think fundamentally at the center of it all is just the issue of trust. Which we feel that there has to be significant trust, there has to be significant involvement. I think that we feel that these processes should be person-centered, and whether we're looking at primary data or secondary data, or primary usage or secondary usage, we know very well that secondary usage normally is not well regulated. So we feel that for some of the intermediaries that are using data, there isn't significant control on that. So I think that, in brief, I think that for us as an organization or for EHDS as a patient-led organization working, we are committed to improving and we are committed to working together with partners across Europe to ensure that data is more streamlined, that it is used for the purposes that it's intended for, and that it actually creates an impact on outcomes of patients, while also being very mindful that there is significant concern on privacy issues and how data is used. So that for me is my view.
Yeah, I can maybe jump in. I believe that obviously digitalization and collecting data, which would then be used for enabling people to get good quality treatment across the border, is a fantastically needed opportunity. We know that most of the people, especially living in Western Europe, don't have access to the best care over there, and they're anyway migrating from the east. I'm looking at Romania, Bulgaria, who are traveling or working across Europe, and they might go to Scandinavia or Western Europe. And I think it's very important to have the files following you. The really big challenge that I have when it comes to data collection and data use is the ownership that the person has and the potential risks that we might have with how those data might be used. And I'm just going to openly share my distrust to the governments and the government officials that might have access to that private data. Mostly Hungarian government, when it comes to Roma, has done everything possible to expose these populations to discrimination. And I believe that my fellows Roma activists across Europe would be extremely careful with how this data is collected, whether or not the data is anonymous, whether or not the data is enabling people to have access to the full identity of the person, data breaches. I think all of these things are extremely, I think we need to move fast, because obviously the whole purpose is very useful, but we also need to sit down and understand how can we actually perceive or consider ways in which this data can be malused. And I'll say the biggest concern, and I attended a meeting with Microsoft on AI, and I was really surprised to see that in that meeting, there were 99.9% people from the same background, meaning IT specialists, big data specialists, talking about how we could actually improve the code. I have not seen civil society who says, wait a bit, AI is as good or as bad as the people coding it, right? All of the biases that we have as people, even not necessarily willingly, can actually be translated into the AI. And if we have discrimination at a specific level, AI can actually take this to an extremely high level. I think there was a paper in Science which was talking about the quality of care that Black people and white people were receiving in the US. And it was just a software which was deciding that people with Black skin would get a completely different quality of care, much lower than white people. We've had situations in which the Dutch, and I actually have all the respect for the openness of the Dutch government compared to the Romanian government, Bulgarian or Hungarian, but still the Dutch officials were using data for people from welfare, and they were linking payments that a person on welfare was making to buy alcohol or whatever, and they decided to cut the welfare benefits. I think to me this is a major intrusion in privacy. I really think we need to be extremely careful, and it's our responsibility as civil society to really put a bit of brakes on all of these things which are developing too fast. Thank you.
Great. Thank you. Let's move to Linda. I think you tried to come in before.
That's okay. Thank you so much. So in terms of opportunities that the European Health Data Space can offer, well, it's a really complex, as we have just seen, it's a really complex and ambitious initiative. Generally speaking, it's widely welcomed by all stakeholders, including Cancer Leagues. And as a civil society organization, we believe that it can help deliver evidence-based policies. So stemming from the research, science, the evidence, and also taking into account other features, societal needs. So for sure, it's a great opportunity to boost research and to give answers to many unanswered questions. For instance, a better understanding of conditions and a better understanding of the biological mechanisms, for instance, behind some rare cancers. And in terms of the downside and the risk, the threats that it can bring is the fact that in our daily life we experience some issues with IT, cyber attacks, and digital literacy is really poor and little in some areas. So on the one hand, it's ambitious and it is needed. It is attracting a lot of attention from all stakeholders, policymakers. It's driving major funds in this area. But on the other hand, we also need to be concrete. So whenever we have these IT issues, sometimes the hopes go down. But let's see what we can really achieve.
So maybe I can complete a little bit with our point of view. I will not go back to what can be the benefits regarding the improved use of secondary use of data, because I think it is self-evident, although it still needs to be clearly explained to users, basically. I think that there was one opportunity for the EHDS to succeed, is that there is a raising awareness regarding the need for strong health data governance and organization to host and grant access to this data generated by users to the benefit of various uses, but especially for the public interest. And there was a question in the chat regarding, well, what can, let's say, less developed countries can do regarding that, because from the French perspective, I feel quite lucky because we have a strong French health data hub with important human and financial resources. And so it's really a great opportunity. But how can other countries, maybe with not this same political will and same resources, will be able to deal with that? So this is clearly something that can be an issue. And one big threat is a fragmentation of stakeholders who will not be able to share efficiently data or grant a global access to it, and to do it according to shared values and principles. And so what the example of Hungary and the maleficent use of data is something that we, as civil society and patient associations, need really to be careful and to monitor these situations. And maybe that's where basically the value of users' participation really lies, to improve the systems and have safeguards that work efficiently here.
Thank you very much for these reflections. It really sounds to me that the balance between opportunities and threats of EHDS as a proposal comes down to, of course, questions of trust, questions of equity, which depend on the level of interaction and engagement of EU citizens have, right, with their own data. Now, there's, however, a bit of an issue here, right? Because when asked in December 2019, only 45% of EU citizens said that they would like to have a more active role in controlling the use of personal information, right? So that's slightly less than half of the people that actually feel encouraged or feel engaged in the questions of data governance. So how do we encourage citizens to take a more active role or a more active approach in managing their health data, and thereby hopefully ensure a greater level of equity, a greater level of trust, etc.?
Maybe I can go first this time. I think that the healthcare professionals really play an essential role in this, because as also was mentioned before by Hugo, building trust is really critical. And citizens really go to their doctor, the nurses, they ask questions to the pharmacists, and these are pivotal figures in the community. So in the first place, these healthcare professionals need to deliver correct information, unbiased, and it's really important to nurture this dynamic relationship that has been existing since forever. And the COVID-19 pandemic actually showed how the community trusts the healthcare professionals and are willing to share data, private data. So I think that also the pandemic can be something that we can look into to learn how this psychological angle, social angle will impact concretely in the daily life of citizens. So not only patients, but citizens, because I really want to differentiate the two categories, because we are all citizens, but luckily we are not all patients. And the needs and the use of health data is different. So building trust is for sure necessary. And another point is to really bring the infrastructure, the services to the citizens, because if they don't get access to this, that they don't know that it exists actually, and they don't know that they can make use of this. So also the knowledge and covering this gap is necessary to look into.
Okay, thanks a lot, Petrika. Go ahead.
Right. So I would really want to challenge what Linda just said. because I come from a completely opposite direction. I really think that COVID is the litmus test, which proves that we don't trust the healthcare professionals. And to me, I think this is really the new information that we're getting, is that in Romania and Bulgaria, the doctors are saying, go ahead and vaccinate yourself. People don't want to do it. People in Romania, Roma communities, actually distrust the healthcare professionals. And they distrust the healthcare professionals because the way they've been treated in the past 20, 30 years, right? So many of the people from my community actually postpone greatly the moment when they have to go to the hospital because they know they're going to be treated completely different. And I think this whole level of trust that Linda's talking about, I agree, maybe it works for a wide majority of populations in Western Europe. I think in Belgium, there's a completely different story. But if we speak about Eastern Europe and other places in this, there's not really that level of goodwill and trust between the citizens or patients and the doctors.
Can I quickly reply? So no, for sure, my intention was not to generalize, and there are different situations and different settings. So for sure, one sentence doesn't fit everything. But I'm also wondering, is the trust in healthcare professionals that is missing, or the trust in the government? Because also in Italy, for instance, we saw a lot of discussion. We're still having a lot of discussions on whether to trust the government and what they say or not. So also it's a way of how the information is provided and the sources that the information is coming from. Conflicting information sometimes is coming from different sides. So for this reason, converging the information based on science, based on evidence, this can be the solution. But of course, there are other features to take into account, and for sure, I'm not in the position to generalize.
And if I may just come in, of course, I think Arok, you asked how we can improve, engagement, of course, with communities. And I feel that at the center of it already, there are two issues. I think one of it is being realistic about what's really happening. So we know, for example, with the populations that are underserved, whether we're talking about LGBT people or sex workers or migrants, we know that there are legislations that penalize people that are discriminatory, that really discourage engagement with healthcare, for example. And at the same time, we are quite keen to engage people to be able to process all this data, to collect, process, and transmit this data. It's just very, very contradictory, because on one hand, you cannot show that you are really caring about everyone and you want things to improve and healthcare to improve. And on the other hand, you have got laws that discriminate people. So I think that we need to really have a very good look at ourselves and see how some of these national laws really impact people's engagement and ability of healthcare professionals to engage effectively with people who need care most. The other thing I think is just really around co-production. So, we've seen, of course, there's been a public consultation on this process. And I was reading and I was saying that there has been a bit, not being very critical, but I think that 387 is not enough for a whole European region. And I felt that there should have been more engagement, more time given for civil society organizations, for example, to engage with citizens and to ensure that there's greater understanding of these issues. Because in some countries, there was just one response, for example. I think that, we need to have processes that are inclusive, that are not top-down. So if people are going to buy into the whole concept around data and how we can make very good use of data, I think that first of all, you've got to be able to build that capacity. And I'm quite happy that, there was a mention initially about how capacity can be built so that systems and processes are prepared to optimize the advantages and benefits of e-health. So I think that we need to. EHDS, for example, has been involved in a number of initiatives. One of it was Emerge, which was aimed at engaging in promoting engagement with clinicians who are living with HIV. And that had its benefit in that it's kind of, people who are involved in this process on that project, particularly, it was an app that allowed clinicians to engage with patients. And one of the the outcomes of this was that it was very, very the levels of confidence of patients improved because they knew that they were in control of their data. The engagement with clinicians improved because then they were quite, it eliminated the need for visits and travels. So the benefits were there. And if you look at this at a very personal level, because the tendency is always to look at things at a higher level, at a patient level, there is significant trust developed when somebody knows how their data is going to be used. And so, I just think that we need to, in all these, processes that we're undertaking, we need to be able to calm down and have conversations at a clinical level, for example, at a clinical facility level, at a patient group level, to ensure that we build very strong foundations for literacy, digital health literacy and e-health initiatives.
I just want to build on what you were saying, Denis, because I totally agree with that. As civil society groups and patient associations, we are more and more involved and asked to participate. But we need to engage users and patients on the more individual level, absolutely. So we need to multiply the medium of information because users are as desperately lacking knowledge about what is data, how they generate it, how they can benefit from it. And we need to multiply media of communication regarding what are the tools and services that actually exist to help them handle this data, control this data, and exercise the rights regarding data collection, data access, data modifications. And one thing from our perspective also that we are often asked to participate with our governments to bring the patient perspective to the discussion with individual on the individual level also, but in the regard of health data globally, we often struggle because users, they focus on the cybersecurity. And of course, this is really a big issue. And so we have to acknowledge these fears, but they cannot go further this fact. And we need to bring to the table as civil society and users representative in practice, how will this data be used? How will they be able to benefit from it in the daily lives? And we are struggling to bring to this table this added value, this expertise. It's like in the medical field, because there's a medical expertise from health practitioners, but we should not replace it, but bring to the table a complementary expertise, which is living with a disease, for example. And so in the same way, we should not, as users, be stuck in this position regarding cybersecurity is the main fact, is the main issue, is the key feature of all these systems. And we need to bring to the table what made our added value as civil society. And this is really a challenge for all of us to, on the individual level, as Denis, you said.
Thank you for these reflections. I would like to bring in Hooft now, because we had a very interesting question from the audience. Asking how does the Commission reflect on these fears, these concerns? Of course, this is probably not new issues to the Commission. So, Hugo, the floor is yours.
Yes, thanks, Rok, and thanks a lot for the discussion, because indeed, I think a lot of the points that have been raised are very valid. If you look at the at the proposal for digital health, it does not stand apart from the healthcare system and the trust system that we have across the EU in the broadest sense. So at the on the one side, absolutely, the European health data space aims to be very transparent. It aims to be inclusive. If you look at the different elements that are being developed, also when it comes to the use cases, the lab results, the images, but also, of course, now with the DCC, the digital COVID certificate, which is in use, we see that a lot of questions are raised about ethics and about how do you use it, what impact does it have on society, and this is a crucial discussion to have. I think also the reflections from what impact this has on Roma communities and what impact it has in certain countries where there is low trust in institutions. This is where I think the capacity building is paramount. We have a lot of disparities across the EU. Scandinavian countries are, when it comes to trust and when it comes to the infrastructure, they are outperforming all the other member states. and then other member states are lagging behind, and they are looking, on ways how to improve the trust in institutions, the trust in digital infrastructures. And I think this is not going to be resolved just by the European health data space. I think this is an issue that is very large, and that should be parts of all the different pieces of legislation. But at the same time, I do have a lot of trust in the European way of doing things. The EU is very much about openness. It's about inclusiveness. We have the GDPR. No other continent on the world has such a strong legal instrument to protect the interests of individuals. Also, I would say for groups like the Roma, of course, the Roma are then faced, how do you go to the government and demand your GDPR to be made into effect? I see that this is a huge challenge, but at the same time, I think that the EU has a certain value set in place that should promote trust, and it's going to take effort from all of us, not just in the digital health space, to build further on this aspect.
Thank you very much. I would like to keep with the issue and questions of trust here, and perhaps continue our discussion in the direction of algorithmic bias, right? Since one of our panelists already brought this up. Now, of course, for those of you perhaps new to this concept, right? A key case of using these large collections of data is, of course, to train artificial intelligence that can support or augment human decision making. But algorithms are usually as fair as the data that's used to train it, right? So in the US, we've had examples where various reports told us that AI is simply reproducing prejudice against certain population groups. Now, of course, the European health data space is going to enter this challenge. Do you think the EHDS can, in the end, guarantee a more representative data and thereby contract algorithmic bias, or is it something that's going to essentially exacerbate issues by introducing more algorithms into more kind of areas of decision making? What do you think?
Well, so this too, when you look at the the risk of bias, but also just the broader ethical aspect of algorithms and AI, we have in place already in the healthcare system. The importance of ethics is paramount. If you see how nurses and doctors are trained across the member states, ethics is right at the top of the curriculum, together with the Hippocratic Oath, do no harm. And this is also why I think the AI Act, the GDPR, but also the way that it's organized in countries again like France, Denmark, Finland, these countries have introduced these national institutions. And before you get access to the health data in France, in Finland, you need to get past the ethical approval board. So if you are, if you have a malintent and you want to get access to the data and just develop an algorithm and put that on the market, which is going to introduce bias and discrimination, the ethical review board at the FinData or the French Health Data Hub will stop you right there. Because in the EU, we enshrine the ethical rights of our citizens quite well. And this is an essential part also of the European Health Data Space proposal, to build further on that system.
Thanks a lot, Petrika. You wanted to come in.
I'm the problem maker in this meeting, because I would like to challenge Hugo. So Hugo, I think you're right. The doctors and the nurses, they have a proper and a sound training on ethics, right? What about the other people who are going to interact with this data? Like the AI and the databases, they're not going to be designed by the doctors. They're going to be designed by people who have a very strong knowledge in AI, big data, and so on. And those are software engineers who are not going through the same ethics training like the doctors. And then I would also want to just raise the point of the ethics of the pharmaceutical industry, who's probably going to somehow be involved in getting access to this data. Like the pharmaceutical industry in the US has a number of practices coming from the very high increase of cost of medicines for diabetes and insulin and so on in the US, simply because they're allowed to, right? So I would say that we can start from the point of trust in the fact that the training and the ethics of the doctors is going to be there, but I really think we need to have very strong controls on who gets access to the data, how the data is going to be used, and how can we actually safeguard the privacy of the citizens.
So maybe if I could just briefly respond to that, because I think it's a good challenge you're raising, Pedro. If I as a patient go to my doctor and the doctor prescribes me an AI algorithm that the doctor was himself or herself not involved in, or no health professional was involved in, then I as a patient, but hopefully also my practitioner, would discourage me from using this algorithm. And if you look at the medical devices regulation, so the EU has also drafted legislation in the area of medical devices, which also covers algorithms in healthcare. If you are going to introduce algorithms in healthcare, you need to get past all the different requirements of the MDR. So you need to go to a notified body. You need to submit all the proof that is required by the law, that there is there's a health purpose to this algorithm, that it doesn't discriminate, that it doesn't do any harm. These are very strict. Some would even say it's too strict, but I disagree. They're very strict requirements to introduce AI in healthcare, and only if you get past the notified body. And of course, you have all the regulatory oversight. So you have the different national data protection authorities looking over the shoulders. Only then can you use this algorithm in the healthcare setting. So, of course, there are still risks, but because it's for the notified bodies and for the data protection authorities, it's a big challenge to oversee all of this because it's a new market and it's a lot that's happening in this space. But the EU is really trying to regulate this properly to protect the patient.
Thank you very much. Would Linda, Denis, or Arthur like to jump in still on this point as well?
Yes, just to add that it's really important to understand who is collecting data, when is collecting data, what is the period of time that the data are referring to, because if you collect the data, you also need to understand what are you reading, what are you analyzing. So it, like, to break down the analysis of the data, it's really important to understand who, when, where, how, and what is the final expected output of this exercise. And for the moment, I think that these aspects are still a bit blurry, let's say.
So maybe to build a little bit on the discussion regarding AI and the French example, because the French Health Data Hub is actually quite involved in artificial intelligence, and before an industry stakeholders or public stakeholders can have access to the French Health Data Hub database. They're very wide. They're required to go through several certifications and to collect a lot of positive assessment from different organizations, public organizations, which all includes users representative and ethical trained professionals. So we are again lucky to have this kind of organization, and maybe it can be difficult to implement everywhere, but this is something maybe the EHDS could be it could be interesting to build on the EHDS to develop some solutions on a more global scale based on user European value and principles to provide some tools maybe to have more prospectively inclusive and representative algorithms, and maybe to have also a retrospective role to help control and assess afterwards maybe difficulties or stuff that can be improved and reduce the biases in algorithms.
Very good. If you agree, let's turn our attention to a question from the audience, because I thought it was very, very important to address as well, and very much linked to our discussion of AI algorithms and products that will probably be the result of the EHDS. And here the question is, of course, the EHDS will be to some extent made possible by public investments in infrastructure, including data infrastructure, etc. How do we make sure that some of these benefits will be translated into public benefits for healthcare systems and patients, and not just commercialized and benefit private interests? If anyone wants to jump in, go ahead.
Maybe I can just quickly build on. Oh, can I go?
Go ahead. Go ahead, Linda.
Just to build on what I previously said. So when I mentioned what is the purpose of the data, why the data are collected, it's also important to keep in mind whether the data are used for commercial or non-commercial purposes, and if it's used by academia, non-profit research centers, or by pharmaceutical companies that of course would make profit out of it. So not only the action of accessing data should be judged, but the why also it's critical. It's actually the milestone.
Yes, just to add to that very important point Linda is raising, because indeed, if you look at the way the FinData and the French Health Data Hub right now grant access to health data, they also introduce requirements on the purpose of the data processing. So, you know, if you are a commercial company from America and you would just like to get the data to develop products, the French Health Data Hub will look at your request very differently than if you are a research institute in Berlin. So this is one important aspect, and the other, to go back to the more broad question of, you know, the costs and the benefits. Obviously, the development of digital health services and products costs money. So we're not going to, you know, blame industry for trying to make some profits. But what we do need to make sure of is that it's, you know, a reasonable amount of profit. What we want to achieve is a level playing field where different players can have a fair go at, you know, enterprise. And if we have, which is the case right now in many member states, if you have a closed, you know, lock-in situation where people are stuck with certain health software solutions, they cannot go elsewhere, and all of a sudden the profit margins go up exponentially, then there is no competition, and then this is not good for the patient because their premiums for healthcare go up. So what we'll also try to achieve is this more level playing field by introducing standards, but also by making sure that newcomers, startups, parties that would like to, you know, try and introduce new services get a fair opportunity to do so, so that we try to limit as much as possible the vendor lock-in situations that we have across the EU right now.
Yeah, so maybe to build up on a little bit on the French example, yes, the French Health Data Hub is really has a really interesting approach, because the final goal of the data treatment is really taken into consideration, and there is a really strong transparency policy on the Health Data Hub, publicly accessible. You can find all the projects that have access to the database, and who is responsible for the treatment, what is actually the categories of data that are used in this project, and you can see that as pharmaceutical and globally health industrials, they represent a minor parts of the projects, basically hospitals and other healthcare providers. Infrastructure are really prominent in the use of this data, and you can see that associations, university, and other academic institutions, they really strongly rely on this databases access, and that industrial stakeholders finally are not do not make the most of the access. So globally, we can say that this health data access benefits firstly to the public interest, basically, because it's not used firstly by the industrials, but by all the ecosystems, including a lot of public actors and health practitioners.
Yeah, perhaps I would also just add, I think that Stefan asked a very good question around how it benefits, the public, especially with all these innovations going on. I think that maybe I would refer to work that EHDS has done, especially with the pharmaceutical industry, around ensuring that there are patient-reported outcome measures in research. It forms a critical component of any studies that are being done. I think that the willingness of the pharma industry, for example, to be able to engage on this and enable an organization like EHDS to consult widely on what constitutes good involvement, especially around discussions, helps. So I think that within the industry itself, especially when data is going to be commercialized, or when some innovations are going to be undertaken, I think that is very important to include the public, and whether that it's done through expert organizations, civil society organizations, or community groups. I think it really helps, because some of these concerns you've seen, like in the US, around bias in algorithms and AI, or if you remember recently, there was a bit of complaint around the fact that Uber software was discriminating against Black drivers, cab drivers, and locking them out of the system for months. All this really comes as a result of not co-producing, innovations, and I think that is really important. That when such projects are undertaken, that there's significant involvement of the public, but also I think that it should be invested. We talk about, Hugo highlighted the need to build capacity, to enhance capacity. I don't think it's the role of the Commission itself just to do this. I think that all actors have to look at the public health benefits and try to invest in these innovations.
Excellent. Thank you very much, Petru. You also wanted to come in.
Yeah, so I think my approach to this would be to recommend extreme caution, because just by looking at the Facebook Analytica scandal, and even the current challenges with the Pegasus spyware, is that every time you have data collection, there's also a major risk related to it. The biggest challenge we have as a society is that we have an unfair way of paying people in the society. So people working in academia or working for public institutions, European Commission or governments, are actually paid much less than people paid by the private sector. So talent and talent pools are not equally distributed in civil society, in public institutions, universities. And I believe that private institutions have much more resources and much more capabilities when it comes to IT, software development, AI. And because of this, I really believe we need to be extremely careful when it comes to providing rules. And I believe that the whole regulatory aspect needs to be extremely well developed prior to us developing and collecting the data. I know it's needed, and I know it's very important to have it, but I'm just seeing the major risks related to this.
Excellent. Thank you very much for these thoughts. Let's now zoom out, and for the final question, consider the impacts of EHDS on the broader health system. Of course, data-intensive health research is likely to result in innovative, better quality healthcare and contribute to more precisely targeted care, such as precision medicine. However, most inequalities are primarily driven by barriers to accessing care, differences in resources, quality housing, diets, health literacy, etc. Do you expect that the European health data space is also able to exert a positive effect on health equity across the European Union? Or is this too lofty a goal?
So maybe I can just jump in to give one example of because I do see the risk of all the disparities that I mentioned earlier across the EU. What you want is that the legislation on digital health doesn't reinforce these, but actually reduces the inequalities. One example, which we were also responsible for in the European Commission, is the European Reference Networks, which is a cooperation across the EU in the area of rare diseases. And there you also see that there are a number of medical centers, especially in Western Europe, that are really well advanced in diagnosis and treatment of rare diseases, have developed over the years a lot of expertise in this area. But rare disease patients don't just live in Western Europe. They also live in Romania. They also live in Bulgaria. And this is why the European Commission has set up these ERNs. So if you are, as a patient, diagnosed with a rare disease in Sofia or in Bucharest, then the doctor that is treating you can have a second opinion, a consult via virtual panels with experts in other member states. And through this system, we are able to promote better healthcare for all EU citizens. Because traditionally, you would be reliant on the expertise and the knowledge and the resources of your doctor in Sofia. So through this digital innovation implemented by the European Commission, we are now promoting better healthcare for all EU citizens with rare diseases. We are doing similar things when it comes to cancer and other diseases. And the EHDS would hopefully, be an instrument that makes it possible for EU citizens across the Union to get access to better digital healthcare. But at the same time, I do see the risks because it's not just the digital infrastructure that you depend upon, it's all the other aspects as well. And this is again why the RRF, 750 billion euros, is a huge instrument to reduce inequalities across the EU on all these areas.
Maybe I can continue by saying that when it comes to health inequalities, it's a really huge topic. So summarizing with an answer, it's challenging, let's say. I would say that the three keywords are infrastructure, as also Hugo already mentioned, but also literacy, health literacy, trust, and one cannot exist without the others. So also what I would like to point out that actually was mentioned in the implementation roadmap that was published yesterday, coming from the Europe Beating Cancer Plan, is the fact that as the final result, we look at the number of countries involved, but as we know, Europe is so fragmented, heterogeneous, so perhaps looking more into the details and at least regional level would be helpful to understand, because countries are so diverse within their own borders. Italy, Finland, they are so diverse depending on if it's a countryside or a city or north and south, east, west. So just barely looking at the number of countries involved in these projects, perhaps it's too limited. But of course, I'm positive to be honest. This is a great starting point, and it's going to be challenging to really implement these tools, this initiative at all governance levels, because it doesn't have to. It cannot remain at EU level in Brussels or in the capitals, but also regional and local authorities really need to implement the tools that are or will be available And there are many challenges, starting from the fact that data are indeed often collected in papers. So we need a change, a transition in culture, even in culture, and how to handle and how to store and collect data in hospitals, and to move away from the paper and make use of the digital tools after considering the privacy and everything that we discussed today.
Yeah, maybe to build on to what you were saying, Linda. I think the EHDS should be an opportunity to take into account in a more refined way all the cultural diversity we have in Europe. And if we overlook this issue, maybe we won't be able to implement successful new actions or policies that are drawn from the result of the EHDS. As we said, Roma population, but racial considerations, religious, all that make our cultural differences should be taken into account. And it could be a very powerful tool to bring this intercultural sensitivity to our policies to address within our borders and globally across Europe, more targeted and more people comprehensive policies, and achieve really results in reducing health inequalities through health promotion, for example. Health literacy is a really important issue, and we know that the diversity of our population is a tremendous barrier to develop health literacy, because every people has different understanding, different cultural way to approach things. So if we do not take this into account properly, we are not successful. And the EHDS may be a very interesting tool to address this issue.
I totally agree with her. I think that the issue of diversity is very important, and I always want to bring the focus back on the individual. We know that Europe is quite diverse, but we also know that we have challenges, especially around migration and the sentiments toward migrants, towards sex workers, towards LGBT people, homeless people. And I think that prison populations, and I think that we need to be realistic and not focus too much on the big picture. I think that we still have parts of Europe of individuals who cannot access the internet, for example. You have cultures, people who are used to actually having the face-to-face interactions with their doctors, and when the digital interventions are introduced, they feel that they are getting disconnected and they disengage with care. So I think that as we look to implement the EHDS, we should take note of the fact that there are significant challenges still around inequalities in Europe. And even if you look specifically at some of the areas like HIV, there are still laws that bar people from accessing testing, from accessing treatment, yet they're in European land. So I think that we need to really look at some of those issues. We need to be able to develop trust to ensure that people do not disengage in care, but also, once we are looking to enhance all this data and to try and make it seamless, I think we need to look at national laws, to see whether they optimize engagement, whether they guarantee safety and confidentiality and privacy that is required. But I do think that we need to be human and really look at, our unique diversities and identities across Europe, and ensure that we do not bar anyone from accessing healthcare just because they were not born in Europe, for example.
Thank you very much for this. As the time is running short, let's move to some concluding remarks from everyone. I'll just follow the screen here. Petru, would you like to start? Maybe a broad reflection on what we've talked about today.
Yeah, I really think I would like to congratulate the organizers for the meeting. I believe that this is exactly what we should be doing. I think this is extremely useful to try to engage with as many people as we can, to try to bring in different perspectives and collectively try to find what's the best way, and also what's the right speed with which this needs to be developed. And don't get me wrong, I'm actually extremely excited about the fact that we're using digitalization and artificial intelligence as tools that are going to help us save lives and identify diagnostics faster, or be able to prevent the need to make the same analysis twice. However, I think it's extremely important that we think things through and we try to remove the risk of this being used in a different way. Thank you.
Thank you very much. Denis, would you like to go next?
Yeah, certainly very excited about this, the European health data space. I think that it presents real opportunities to be able to improve issues. We know that lack of data has been one of the reasons why we don't have very good public policy making in terms of healthcare and out of inequality. So I really hope that this is going to change things. And I also feel that it's very good that the civil society is engaged, and I think that we should be more engaged, in the implementation. So really perfect. And all I can say, thank you for organizing.
Thank you very much. Linda.
First of all, thank you so much for this conversation. That's been really insightful. Thank you also to the other speakers. I really look forward to reading the proposal. Just to conclude, I would say, so we need rules because otherwise we leave too much room for interpretation. So rules and an inclusive approach so that all stakeholders and views are reflected in the next steps, and a clear governance, because it really needs to go from top to bottom. Thank you so much.
Thank you very much, Linda. Hooft, your concluding remarks?
Yes, thanks, Rok, and thanks everyone on the panel. It's been an interesting discussion. And I think we touched on some very essential aspects. When it comes to digital health, the question should always be who will benefit from this? Will it benefit in an equitable way all the EU citizens? Will it improve their healthcare? And aren't we introducing new barriers that were not there to begin with when we had the old-fashioned healthcare? So these are absolutely essential questions that are part of the discussion around the European health data space, but not just the European health data space. I think these the questions raised today, they touch upon many other relevant topics as well when it comes to trust in institutions, trust in your healthcare provider when they recommend certain treatment, etc. I think these are very broad challenges for the healthcare systems in the wider sense. Across the EU, which are all relevant for the digital health discussion. So thanks so much again.
Thank you very much. Arthur, you want to go?
Yes, thanks again a lot for the invitation to this panel and to the other panelists. Globally, this is a really exciting opportunity, and I think it's self-evident for all of us here today that the benefit for refined research, improved care, there will be, the EHDS will provide improvements regarding that. But we have still, I think, a lot of work ahead of us as social society groups, civil society groups, sorry. And the first thing maybe is to really provide to every user an understanding of what is the health data. And it's maybe frustrating because we want to go very fast. We are talking regulations, and this is really great to provide governance and regulatory framework, but still we have on the individual level a lot of work to do, and we should, civil society groups and policymakers and decision makers and every other stakeholders, to really dig into that and to materialize for every users what is health data, what is going on, and what will it affect their lives, basically.
Excellent. Thank you all very much for these concluding remarks, as well as joining us as panelists for this, I think, important discussion. I think we touched upon various very interesting points: the importance of trust, the importance of working together, civil society and decision makers. And generally, I think I come out of this with a positive view of the EHDS, however, with some caution as to how specifically we can implement this. I'll now hand over to Philip Karan from the European Public Health Alliance to take us home. Thank you very much.
Great. I won't be long because I know that a lot of you have other obligations that you need to get to. I would just like to thank everyone, especially Rok and the panelists, for a wonderful job today. I think your contributions have been very, very valuable, as well as all the attendees, because without you, we wouldn't have an event to present to anyone. So I hope you take some valuable messages from this event and share them with your colleagues, share them on social media, whoever. As IFA is always interested in amplifying the voices of the end users, I was very happy we were able to organize this, discussion between civil society representatives, as well as someone from the European Commission, kind of representative of the policymakers. And as some of you have already mentioned, I think we need to have more of these. It's very valuable to be able to communicate, to listen to each other, and maybe take away some messages and learn some things that we might not have thought of before. Yeah, so I thank you all very much for coming today. I wish you all a wonderful afternoon, and I hope to see you in the future again. Thank you very much.
Thank you. Take care.
Thank you, Philip. Thank you.
Thanks again.
Thank you. Bye.
Thanks a lot.